Good afternoon, one and all. Learned organizers, members of the International Advisory Committee, 7th Conference of the Indo-Pacific Academy of Forensic Nursing Science 2021. And theme is very oft, advancement of forensic nursing science and practice. At the outset, Namaskar. At the outset, I'm very much thankful to the respected Dr. Rakesh Goria for providing this opportunity to speak on the medical legal aspects in nursing. He's a very proactive member of forensic science. On 29th of February, 2020, we had a conference, national level conference at Krishna Institute of Medical Sciences deemed to be university, which was on forensic science in healthcare practice. And it was an interdisciplinary conference which was held in Karad, Maharashtra, India. I have immense pleasure to talk on this medical legal aspects in nursing. The purpose is very clear: to practice, to promote the positive change in medical legal management for the detainers, asylum seekers, mental disorders, living and deceased persons, to prevent the victimization and reduce the fear of crime. Forensic nursing process is an art and science of nursing, and medical legal clinical skills are very important to provide the quality care to the survivors, offenders of the violent crimes. And once again, I thank from my core of heart to allow us to provide the opportunity to write our own destiny with the power of forensic science knowledge, wisdom, and power of technology for the Dr. Rakesh Goria, eminent speakers from the since morning, and chairpersons, honorable chairpersons, Dr. Yogendra Bansal and Dr. Mahmood Maqsood. I have, this is the where exactly we are situated in India, Maharashtra, which is most populous center, and this is the university where the last year we had a conference conducted on the forensic science. So this already medical legal aspects in nursing are very important. We are sure that the now healthcare professionals are, we are now aware that healthcare professionals are facing the challenges in the practicing forensic science due to increased burden of cyber crimes, biological terrorism, misuse of freedom in social media and forensic sciences is much needed. And we are in infancy and lifelong learner for this forensic sciences. In this year, Indian Nursing Council has revised the syllabus in the forensic science, and they have given special weightage and emphasis on the forensic nursing science. So this in this our institution, Krishna Institution, we have 700 students for this one. So my request of all the members of this forum, so we wanted to start forensic nursing science and department at the Krishna Institute of Nursing Science, Medical Sciences deemed to be university. And we would like to collaborate for this forensic sciences and take up these challenges for the quality care. So this will be this is my humble request, humble submission to all of you, members of this forum. Healthcare provider play very important role in, and the nurses are the backbone of healthcare system. Forensic nursing is the application of science, nursing science to public and legal proceedings, and the nurse's responsibility and accountability in the legal aspects is very much increased. Nurses' responsibility is increased due to misuse of the social media, increased road traffic accidents, biological terrorism, and challenges related to it like organophosphorus poisoning and like homicidal suicides, imbalance between intelligent coefficient, spiritual coefficient, and emotional quotient. Imbalance between the violence of intimate partners, domestic violence, psychological injuries, elder abuse, negligence, human trafficking, and medical legal aspect is a major concern. And this is So what are the main important legal aspects and what are the functions of law and how it is useful to the nurses? Because of the right framework for the nursing actions. What nursing actions we are performing, the nursing procedures in the care hospital for the patient quality care. So if that provides, the law provides the framework for the nursing actions and differentiate the nurse's responsibility, as we have a different cadres in the nursing, like auxiliary nursing, general nursing, diploma nursing, degree nursing, postgraduate nurses, PhD nurses, MPhil nurses, even for the service side and education side. And we have integration for the service and education and service. So it differentiates the nurses' responsibilities. So law protects the nurses. It is a safeguard and boundaries of independent nursing action. So which are those boundaries for the independent nursing? Still in India, independent nursing is not so far practiced. There are some boundaries like nurse practitioners course. Recently, in Indian Nursing Council, nurse practitioners course is started in critical care, midwifery, and primary health care. But there are the boundaries. They cannot practice independent like states and other states, like states like America. We don't perform independent competencies. It is interdependent. In consultation with the physician, surgeon, we conduct the activities, and so that is why law protects. But maintaining the standards of nursing practice, it's very, very important task, and this law helps, and this is the main function of law, because maintaining the standards in nursing practice. We have a separate guidelines for the nursing standards for the practicing the this one, but interdependent, as an interdependent profession, we have to be dependent on the physician and protocols, institutional protocols of the institution where we practice. So what happened with what is important law for the nurses? They take the responsibility with the accountability, and the number of advanced practice nurses are increased. They assist in the decision-making process, protection of nursing practice, and identification of risk of liabilities. Where we know we are very well all over India, very well aware about the Aruna Shanbag's case. She had raped by the ward boy, and she was 36. I would like to share that important incidents and the risk of liabilities. 36 years she was in the coma in the KM hospital, and last 5 years back she has been there was an issue like euthanasia, regarding euthanasia has been, but it is not permitted in India. She was 36 years in the coma because of this we were failed to identify the risk in time. So what are the effects on law of nursing practice? Who is the client? Nurses, whenever patient enters in the emergency area, there are certain guidelines to handle the patient. What is the age of, suppose the patient comes with the mass casualties, then nurses with the triage principle, she can identify what is the level of, who is requiring the treatment, what is the age of the patient, who is at life-threatening situation. She has to categorize, and the triage principle she is following. And many of the area, since we are in the rural area, we are facing many challenges. Like once patient, I can share the one small incident that the road traffic accident was happened, and young boys, 18-year boy was unconscious. He was in a gasping situation, and members of Rotary Club, International Rotary Club, they had finished their meeting and they were bringing the patient to the hospital in the rural area, not in the institution. It's a small dispensary, and they have refused treatment to give the treatment to that patient. 18 years boy was in the gasping situations, and we were witnessing that situation, that those who are handling the patient, they were not knowing the legal Supreme Court's guidelines. He was not ready to take up the patient, and patient was in a life-threatening situation. Then we take the further higher centers, and that patient was treated. So this is the effect of law. If this person would have been known, and afterwards that patient was survived with the craniotomy has been performed with he was met with an accident, head injury. Patient survives, got well, but because of ignorance of this law, that patient would have been suffered because of this ignorance in the law. So in rural area, still so many challenges we are facing in the emergency situations. Like those who wanted to do some good Samaritan acts, they are also facing the challenges. So forensic science is much needed in rural areas, specifically in A class cities, metro class. It is very good to handle. People are aware with the law, what is the law, and what is awareness. So in hospital, like tertiary care hospital, in primary level hospitals, we are facing these challenges, like the use of restraints. Patient comes with a head injury, patient comes with a rowdiness, and how to use the restraints. And if this person knows the law properly, she will explain, nurse will explain the patient's families regarding the restraints, how useful or not useful. So this is about the restraints and dying patient's wishes. Sometimes patient wants to talk something, so law helps. The last dying rights are there for the patient. And even the maintaining the confidentiality. I can share the one example when we are performing screening with the handheld devices, when we go for the screening in this rural area. So confidentiality, people are having different types of myths. She has gone for screening, something happened to her. Like India is like conservative and ladies are very shy. So confidentiality has to be maintained, what we are screening and where we are screening. So we are going to house and screening for the earliest detection of the breast cancer with the, using the artificial intelligence. So, and again, this law helps us for the nurses and then we can maintain the confidentiality and privacy also. And a proper documentation is required in nursing profession in regard to the research, administration, and even education, academics. Incidental reports are very important, incident reports, and the law protects us and each and then here also I can share the report, share the one incidents when I was working in the hospital as OT nurse, as a staff nurse, and one of the patient came with the anaphylactic reaction, and certainly it was very simple ant bite and had a vasovagal shock, and nobody knows why he had sudden vasovagal shock, and he brought to the hospital, and patient was taken for the emergency. All the management, they have done it, and what was in sudden, then after stabilization, patient was become all right. It was anaphylactic shock. But there was something, incident report was that informer told about the proper history, what ant bite, simple ant bite and taking coffin. And this might have happened. I'm not sure that what has happened, but that incident she has told that coffee, after drinking of the coffee, and he had a simple ant bites and he had developed some vasovagal shock. But incident reporting was very clear, so doctors were able to treat the patient. So incident report, that time that nurse was handled that case and proper reporting has been happened. And this is the law. If somebody knows, otherwise there will be some chaos. So medical legal issues, these are very important issues, because we are facing now and then medical legal incidents. Now in this, during this pandemic, the ventilators were not available at the, so many ventilators were not available. So which patient has to be removed? Then nurse has to know the patient activity tools properly. Then only she can handle the medical legal cases. The people were with the myths in the villages, in the tribal areas, people were not allowing nurses and they handling the cases. Like they were not allowing the nurses to come to home with when they are using the PPE kit and all these things. So this myths and also these are the issues. So ventilators were not available at a time. Many patients used to come. Somebody were in the ambulance and somebody is on the road. They were waiting for this one. So these issues with the law, proper knowledge of the law, medical legal aspects in nursing, one can handle the patient with the confidence and patient can be survived. When it happens, the legality should be followed in physical examination. Many patient comes, like female patient comes for the abdominal pain, and whenever doctors are checking, female nurse should be there for the privacy. And with otherwise only male doctor cannot be allowed in this rural area. It happens that sometimes sagging of the breast, and sometimes doctor may touch. So these are the issues again comes, and again complaint against doctor or nurse happens. So always there should be there are issues. So she should have a proper knowledge about the issues. And whenever cases comes with the burns, burns, like some suicidal attempts, patient comes with the organophosphorus poisoning. Nurses has to perform biggest role. Whenever patient comes with the corrosive poison, she has to have a proper knowledge about how to collect the whatever he has consumed, the compound that she has to preserve, she has to send to the forensics department for which or the substance he or she has taken. In case of non-corrosive poison, she has to gastric lavage. After giving this gastric lavage, what is patient's name? If there are some food poison patient comes, she has to do all this, handle the cases in a proper way. In accident cases, many of the patient comes with the unnatural accidents. So she has to handle the cases. She has to know the medical legal aspects. In the MLC cases, where patient has come with the conscious patient, unconscious patient, relatives are there, they are not there. When ornaments, when documents, she has to, or he has to, as a nurse, he has to handle it to the proper departments and take documentation is very important in medical legal cases, organophosphorus poison cases, accident cases, and even suspected evidence of criminal abortions, sexual assault. So in the Supreme Court, as everybody is aware that Supreme Court has guidelines, and every university and every educational institution is following the Vishaka guidelines for the prevention of sexual assault, and internal complaint and committees are there to complaint for any sexual aspect assault or suspected assault. There is a committee, so they can go and grievance redressal can be done in that committee, and that is Honorable Prime Minister has announced. Okay, there each and every tertiary care hospital should have a crisis intervention center, so that these cases will be handled in a priority, and priority will become main concern for this handling this type of cases. In unconscious patient, again she has to see what kind of patient or unconscious, why he is unconscious, what are the reasons. If relatives are there, she has to ask the history, or there is a team for this unconscious patient in casualty or triage. They will have to ask the history about if patient's relatives are available or not available. They have to see the information from other signs and symptoms parameters. They will have to diagnose the patient. So handling the medical legal patients are very, very important for the nurses. Again, this eminent speaker has spoken about these thoughts, intentional thoughts and unintentional thoughts. So I'll skip these topics. Negligence at unintentional thoughts, like a negligence is very, very bad part from the nurses side or healthcare provider side. A negligence, we can give the example if the patient comes in the hospital and when I have seen in the patient was with the hypothermia. A patient was operated for cholecystectomy. He had a post-operative in the bed and he had hypothermia. And here oxygen level was SpO2 was very down. And then doctors were thinking about different parameters, but there was a negligence from side that patient had a common cold and it was thick mucus. And that is why that oxygen was not going properly. Nasal prongs were blocked, and that is one kind of negligence. And then suddenly after removing the nasal prongs, SpO2 saturation was good. So this kind of negligence is not tolerated in any healthcare system. So this kind of unintentional thoughts can happen. Even malpractices in this corona time, malpractices has happened for the remdesivir and all this in this pandemic situation. So malpractices are happen unintentionally. Malpractices. Sometimes patient may not touch to the patient with the corona, with the fear of corona. So this has happened during this pandemic. So there are legal safeguards for the nurses. These are very important. So with these legal safeguards for nurses may live happily with his or her professional life. She can, whenever patient comes, she has a right to take informed consent. Even doctors informed consents, written consent for the operation or any other chemotherapy. Then she can see what are the physician's order or surgeon's doctor orders for the patient for the treatment, which chemotherapy should be given or which medication should be given, what kind of diagnosis. She has a right to see his case paper or her patient's case paper, then write documentation. she has to, while documenting, while giving the medication, she has to observe the rights of the patient, right route of the patient, right age of the patient, right name of the patient, expiry date of that medication, that she has to see, and documentation in all aspects, like progress of the patient in any case of research, with the permission, consent of that patient. Then if it is not happened in a proper way, or within a framework, she has to go for the collective bargaining, and then she has to report the incidents for the patient's quality care and patient's progress, health progress. So these are the different laws are covered by eminent speaker. So these are again medico-legal ethical issues, consent and capacity. One has to give the consent for the written consent, or one can refuse the treatment. Patient can refuse the treatment. They have a patient's rights are there. They can refuse the treatment at any time, or they can accept the treatment with a proper explanation by the nursing, whatever procedure she is performing or treatment she is performing. Healthcare providers are performing any treatment, they will have to explain the patient properly, and they have a full right as to reject or accept the treatment. Then confidentiality should be maintained by the healthcare providers, and use of precedents. Then refusal of alternative medicine. Alternative medicine, if patients are now doctors, like the medical shopping, they say many doctors, many pathies they are following homeopathy. This pandemic time we have observed homeopathy, allopathy, Siddha, Unani, some different pathies they are, patients are coming with that. Then nurse is confused which medication should be given. Sometimes patient may refuse this, I don't want this treatment, this I have taken, so the adverse reactions may happen. So that time legal safeguards will protect the nurse to practice profession faithfully. So there are some Nursing Practice Act in India. As per that act, Indian Nursing Council has given the minimum standards, and deemed universities, they can practice autonomy, and they can, for the academic, for example, academic, they have increased the curriculum. Right now they have revised the curriculum like forensic nursing, and that more emphasis is given. So grade 1 A plus double plus universities can implement the syllabus. Grade 2 university can have that syllabus. They can include the curriculum in this one, nursing curriculum, even other curriculum. Also, they can increase the forensic, revise the syllabus, and can be added emergency modules like forensic nursing. Nursing Practice Acts in India. In other countries like states, they have independent practice. In India, they can't practice independently. There are some certain ads, they will have to follow the institutional protocols for the standard operating procedures in the institution for performing the nursing procedures. So there are issues. So the ethical principles are guiding principles like truthfulness, loyalty, honesty, irrespective of their honesty, communicating in the truth, in the word, like, and withholding the information from the client, which information should be withheld from children, or they are small, if they are legal guardian, she has to tell them. She should be, nurse should be honest, and she should be truthful to her profession and her commitments regarding the nursing procedures. Justice, it's a fair and equal justice she has to give to the patient. Fidelity, she should be loyal towards the care, or she should not discriminate at the age, sex, or creed, caste. She should not discriminate the patients. And there are the bioethical issues also regarding this, giving the pills, for example, birth control pills. Again, some family members will say no, it should not be given. Then these issues also again facing. Then mercy killing, like I have shared the example of Dr. Miss Aruna Shanbag. She was a nurse, and euthanasia. So in India, this mercy killing is not that extent it is allowed, euthanasia. So this is about the bioethical principles. And so these ethical principles, all healthcares must provide. In conclusion, I can say all these medico-legal aspects are very, very important, And we are in infancy, lifelong learners as a profession. So this forum of this Forensic International Asia Pacific Forum will help to glorify this nursing in, and collaborations. Will have many collaborations for this forensic nursing, and will gain the knowledge, and nurses will be immensely benefited with this forensic nursing science. I'm very much thankful for the organizers, Dr. Rakesh Goria, Dr. Yoginder, and Dr. Mehmood for if I have any suggestions, I'm fully accept that. I will fully accept the suggestions. Thank you for patient listening, and thank you very much for the giving me chance to present medico legal aspects in nursing.